Hello, my name is Olivia Law, and my presentation is on nutrition support for Hyperemesis gravidarum. Hyperemesis gravidarum is characterized by extreme levels of intractable nausea and vomiting, as well as distorted olfaction responses, fatigue, and hypersalivation. According to the Royal College of Obstetricians and Gynecologists, they have suggested certain criteria for diagnosing the disease. These criteria include weight loss of greater than 5%, admission to the hospital, and also signs of dehydration. I will go over some background of the disease in detail, starting with population. So hyperemesis gravidarum affects 0.3 to 2.3% of all pregnancies. About 60% will resolve within the first trimester of pregnancy, while an estimated 90% will resolve by the 20th week of gestation. Reasons for persistence of the disease past the 20th week of gestation are unclear, but many factors have been linked to prolonged duration, such as allergies, restrictive diets, a lower maternal age, and maternal overweight. Women suffering from hyperemesis gravidarum may also have an added stress of medical costs because of their routine visits to the hospital. The cost of healthcare may even influence a patient's decision of whether they would like to continue treatments or hospital stays, or whether they would prefer to terminate their pregnancy. There are about 19 to 30% of women who are admitted to the hospital for hyperemesis gravidum who will also have to return for a second hospitalization during their pregnancy. And of course, continued hospital visits and stays can drastically increase healthcare costs, and it can also create a burden on the healthcare system. So along with negative physical outcomes, the disease has also proven to affect the mental health of pregnant women as well. Some themes associated with the disease regarding mental health include social isolation and also an inability to care for oneself as well as others that they may have cared for in the past. Negative physiological effects that may be associated with hyperemesis gravidarum include depression, a sense of dying, suicidal thoughts, loss of earnings, loss of employment, and also changes to family plans. There are many different types of treatments that have been used to decrease nausea and vomiting during pregnancy. I have included some of the treatments here. So recommendations may include avoiding trigger foods or even consuming smaller meals. An example would be a carbohydrate-rich snack such as soda crackers, and something like this may help to alleviate symptoms of nausea and vomiting for women during pregnancy. An inpatient treatment that may be used would be intravenous hydration with appropriate electrolytes. And then there are also some alternative methods of treatment for women that are diagnosed with hyperemesis gravidarum, and these may involve non-pharmaceutical routes. Included would be something like cannabis or hypnotherapy. Now, for more severe cases of hyperemesis gravidarum, women may require different routes of treatment, such as total parenteral nutrition or enteral nutrition support. Now, the purpose of my research was to evaluate fetal maternal outcomes such as birth weight and preterm birth among women receiving nutrition support for hyperemesis gravidarum. And I have also included some of the research articles or the authors here of the research that I included in my paper. So a study completed by Pett et al. In 2013 was a retrospective cohort study. It was used to assess pregnancy outcomes among women with hyperemesis gravidarum with and without total parenteral nutrition. This study concluded that TPN during the early stages of pregnancy is related to a decreased risk of perinatal morbidity. So this study had positive outcomes regarding total parenteral nutrition. In 2014, a study conducted by Levin et al. Examined the nutritional state of pregnancy complicated by hyperemesis and the effects of total parenteral nutrition on maternal nutrition and fetal outcomes when given during the first trimester of pregnancy. This study included 10 pregnant women and 10 non-pregnant women, they were studied as two different control groups, and then the two control groups were then compared to 9 pregnant women who were hospitalized with hyperemesis gravidarum. This study concluded that the results supported TPN as an effective method of nutritional support during the first trimester of pregnancy. In 2015, a retrospective cohort study was conducted by Stoke et al., and it included 558 women hospitalized with hyperemesis gravidarum from 2002 to 2011. The purpose of the study was to examine fetal and maternal outcomes among women with the disease, comparing enteral tube feedings with other fluid or nutrition regimens. This study did conclude that, compared with other fluid or nutrition regimens, enteral nutrition for women affected with hyperemesis is associated with sufficient maternal weight gain and positive pregnancy outcomes. So another study with positive outcomes, this time involving enteral nutrition. And then I also included this study as well by Grutin et al. Now this study was different. Unlike many of the other studies, this study did not result in additional benefits from enteral nutrition support. This study concluded that early enteral feeding in women with hyperemesis gravidarum does not improve birth weight or secondary outcomes. All right. So in conclusion, based on the included research, without treatment, hyperemesis gravidarum can lead to many negative outcomes, physically as well as mentally. Hyperemesis has been treated using pharmaceutical methods, as well as alternative methods such as cannabis and hypnotherapy. Other methods of treatment for women that are experiencing severe hyperemesis gravidarum include enteral and parenteral nutrition support. And again, the purpose of my paper was to evaluate fetal maternal outcomes such as birth weight and preterm birth among women receiving nutrition support for hyperemesis gravidarum. Based on current research, enteral and parenteral nutrition support can be considered a means of successful treatment among women with hyperemesis gravidarum. I've included clinical implications, and these are my clinical recommendations that I included in my paper. My first recommendation was, when administering TPN or EN, daily electrolytes and glucose determinations should be closely monitored. And this is because all patients may require the addition of fluctuating amounts of insulin to the TPN or EN solutions because of hyperglycemia, which may ordinarily occur because of increased glucose loads. My second recommendation was to administer TPN in early pregnancy. TPN in early pregnancy is related to a lower rate of adverse pregnancy outcomes, such as preterm delivery, fetal growth restriction, and adverse short-term neonatal outcomes. My third recommendation was to start TPN on a solution consisting of freamine 3, 4.25%, and 25% dextrose or a similar solution. This will give about 1,000 calories per liter. It will also supply essential amino acids for formation of body protein, and it will provide a calorie source that's easy to utilize. On this slide, I have included a list of all the references that I used in my paper and my research. And that concludes my presentation on nutrition support for hyperemesis gravidarum, and I hope you enjoyed it. Thank you.